Okay, well, I'm just calling because my husband just had a gastric emptying study
All right, sure.
because he's been having problems having his food go down, coming back up,
All
a
right.
lot of gas. Anyway, been going on for a long time. He's had all kinds of tests.
All
Anyway, it came back where bottom line is in 90 minutes, only 28% of the gastric emptying.
Okay, so now, does he have diabetes or anything like that?
No.
Okay,
No.
Is he taking any medications?
Yes.
What is he taking?
He takes Topril,
All right.
37 milligrams a day.
It's going to be more than that, but go on. Yeah.
Flomax.
All right.
He takes Zetia for his cholesterol.
All right. Okay, we're going to get to the bottom of this real quickly, but go on.
Taking Nexium for way too long. He just got off of that the other day.
Okay, and you're wondering why his gut doesn't work? Okay, so what do these geniuses propose that he do?
Well, they didn't propose anything. I'll tell you what the doctor proposed he do.
All right, good.
Oh, okay, because I feel like you. Okay, well, the doctor proposed that he had yet another, I forgot the name, go down the throat.
They're going to scope him. Okay, so they're going to do
Yeah,
it.
you know where you go down the throat to look around?
It's called an endoscopy. Yeah, sure, because you generate income.
I'm sorry. Yeah. Okay. Well, they suggest to do that again. Why? He just had another one and another. He's had several of them in the last year.
All right. Well, let's back up a little bit. Let's try to figure out why do people get gastroparesis. Okay.
Okay.
Because in years gone by, you'd go your entire life and never have this issue, but now it seems like every fifth person is told they have gastroparesis. Well, it's probably not that people are getting sicker by themselves. I would have to maintain that the medical profession is doing a superior job in making this happen. And drugs in particular that deprive the body of its ability to regulate itself are really at the heart of it. So if you take away, let's say, neural control, okay, the nerves that control the gut are very, very important to maintain the function of the gut. So, how many brains do you have? Okay, well, you think you have one, but you have multiple. There's one big one in your head, but then there are multiple little ganglia, which are like little brains that go all the way down to, essentially to the bottom of the spine. And when these things are disrupted, the areas that they control become dysfunctional. If the ganglion of impart inside the, by the sacrum gets damaged, you'll have difficulty with micturition, you'll have difficulty with going to the bathroom, many functions in the lower GI tract. Up in the neck, okay, it'll cause cardiac and esophageal dysmotility issues. But there's one that sits right around the gallbladder. Okay, it's called the celiac plexus. This little area here, when it's damaged, the gut doesn't control itself very well. Well, how would you damage the celiac plexus? Well, first thing you can do is induce a CoQ10 deficiency, and the Zetia does a brilliant job doing that. CoQ10 is necessary for nerve and muscular function. Well, guess what? If either nerve or muscle function is damaged, your husband's gut's not going to work. Now we go ahead and we start giving him alpha-2 blockers. Okay, those disrupt the sympathetic nervous system. We give him Topril, which innervates or manages the parasympathetic nervous system or causes it to become dysfunctional. And then on top of that, you take away stomach acid, which is necessary to give the lower esophageal sphincter feedback. So what's happened is they've hit this guy every way from Sunday, and they're marveling at the fact that he's not working. The way I would handle this would be to dismantle it. Okay, I would first deal with the esophageal reflux issue by taking away the PPI or H2 blockers, actually have the stomach kick up more acid, but induce protection using something called L-glutamine. They do that for about 6 weeks. Okay, now all of a sudden you take away this acid issue. You may even start fixing the B12 deficiency that's probably resulted from the lack of stomach acid. After that settles down, then you start backing off on the beta blockers. You start backing off on the issues with his prostate. Now, there are other ways that you can deal with it, some that are a whole lot simpler on the system, a whole lot easier and better tolerated. So I think what's happened here is that he's seen just a few too many doctors, and they're throwing too many things at him and making him progressively sicker. If he's not careful, he's really not going to do too well. So before you start shoving things down his throat, my suggestion would be start backing things off and getting him healthier.